So the 2nd of October marked World No Alcohol Day. It was set aside by the World Health Organization to call attention to problems caused by alcohol abuse and ways to reduce those problems. The organization says alcohol is the world's third leading cause of poor health. Let's get more on this with Director at the Southern African Alcohol Policy Alliance, Maurice Smithers. So Maurice, what kind of impact, if at all, do days like this actually have on people? I saw a couple of people enjoying their favorite beverage yesterday.
Well, we don't really know. I think when these days are announced, either in a country like South Africa or globally, the idea is to try and encourage people to participate. And really, with World No Alcohol Day, it's really saying to people, can you go without alcohol for one day? And more in acknowledgement of the fact that alcohol is a challenge, and for people to consider how they drink, the extent to which they drink, whether they drink in a safe way or not, and also what they think about what's happening in the country, because we would really like more people in the country to support the call for more effective measures to control alcohol-related harm in the country. I mean, COVID has actually shown the country in a quite remarkable way the extent of the challenges we have around alcohol, and we really should have learned from that and moved forward to a new way of doing things. And that's really, I think, what we would like people to think about this year, although we are also linking it to Transport Month this year, because this is Transport Month in South Africa, and we know that there's major issues around people drinking and then driving. So we're linking it to that too.
We know how much trouble overindulging has caused in South Africa. Is the solution to completely ban alcohol or encourage, self-regulation and people checking their own behavior?
No, we don't believe that a total ban is a solution. There's one big example globally of where that was attempted in America from 1920 to 1933, and it didn't work. All it did was it drove alcohol underground, and in many ways created the mafia, because it created a whole network of underground activity around alcohol, which then established a lot of crime families and the crime networks and so on. So we don't think that's a good idea. But what we do believe, on the other hand, that self-regulation is not enough. Because, we all live in a society, we live in an environment in which our behavior is to an extent shaped by what is happening around us. And so the World Health Organization itself has said that while education and encouraging people to drink safely is a good idea, it won't work unless you have the right regulations in place. And so they call for effective regulations which will do three things. One is to limit or ban alcohol advertising altogether. The second is to reduce the availability of alcohol. And you would do that in various ways, through increasing the age of drinking, reducing the number of liquor outlets, limiting the hours of operation. So instead of going till 2, 4 o'clock in the morning, you maybe stop at 11 o'clock at night or midnight. And then the third thing is to increase the price of alcohol. South Africa actually has amongst the cheapest beer in the world. And the cheaper the alcohol, the more people will drink. So therefore, if you increase the price, you're not telling people to stop drinking. You're just saying to people, please drink less. And it can work. In Russia, in 2018, there was a report from the World Health Organization where they pointed out that in Russia, which has also historically had an image of being a hard-drinking country, they have managed to reduce alcohol consumption by 43% over the last 20 years. And so that's really what we're looking at, is how do you actually reduce the amount of drinking, particularly by people who engage in binge drinking, where they just drink to get drunk. They don't drink to socialize. They don't drink to relax. They drink to get drunk. And that's the kind of thing that's got to change. But we also have to remember that in South Africa, only about 31% of people drink anyway. So it's not as if we have a problem of 70, 80% of people drinking and drinking badly. That isn't the case.
Thank you very much for your time this afternoon.